So, equine recurrent airway obstruction, or RAO, is a chronic inflammatory obstructive disease of the respiratory tract, and it's most commonly affecting mature horses in stabled environments. Some people believe that this can be further broken down into two seasonal components, and that's going to be chronic obstructive pulmonary disease, or COPD, and summer pasture-associated obstructive pulmonary disease, SPA-OPD. So for COPD, this is going to occur predominantly during the winter months, and it's going to affect mostly stabled horses. And for summer pasture-associated OPD, it's going to occur predominantly during the summer months, and it's going to affect horses on pasture. There is a little bit of debate about whether or not these two conditions are separate entities or if they together form RAO. There were a little bit of conflicting views in different papers that I did read for in preparation of this presentation, but I think the bottom line is just to recognize that there are some similarities and some overlap between COPD, SPA-OPD, and RAO. So some other terms of use for recurrent airway obstruction are going to be heaves, emphysema, chronic bronchiolitis, and broken wind. Now all of these can be used interchangeably, but heaves is going to be your most common. You're going to hear this the most. You're going to hear people saying, my horse has heaves, I think my horse has heaves. It's just a slang term, and you're definitely going to hear this one the most often around the farm, and it's just a layman's term for RAO. So a little bit of history behind recurrent airway obstruction. It's pretty brief, but I did think there were some interesting points. In 333 BC, Aristotle first recognized RAO to be an equine disease. He described the heave line in horses demonstrating respiratory complication for the first time. Also in 1656, scholars associated RAO with stabling horses in a dry environment. And then finally in the 1900s, RAO was first linked to consumption of poor quality hay. Now this time it wasn't understood to what extent poor quality hay did contribute to the respiratory distress of horses with heaves, but it was important to recognize that it was associated with the condition. For prevalence, studies have found RAO to affect anywhere from 50 to 80% of the entire equine population within the northern hemisphere. This does make it the most common chronic respiratory disease seen in stabled horses of a mature age. And so who is likely to develop RAO? Again, geographic location, northern hemisphere, horses in the northern hemisphere are most likely to have heaves. Also, as far as an environment, horses that are stabled for several hours a day or maybe left inside all the time during certain times of the year. Horses that are at least 5 years or older are going to be more susceptible in developing symptoms or clinical signs of RAO, and this prevalence does increase with age. As far as breed, certain breeds are suggested to be more susceptible to developing heaves, some more than others. Now, several papers I read did mention that there were breed predispositions to developing heaves, but none of these papers mentioned specific breeds that were highly susceptible or less susceptible to RAO, so I couldn't find that anywhere. I do know that in my experience, I've known several quarter horses to have heaves and a few thoroughbreds. Now, I can't say with certainty or with any scientific evidence that they are indeed more likely. I just know those are the only ones that I've come by, so that would be something to look into further. Also, genetics. Offspring of RAO-affected horses are going to be more likely to develop clinical signs. So, pathophysiology of RAO, you're first going to have an exposure to an aeroallergen, and we'll get to this in a minute. I'll give a list of what these might be, but basically it's anything that can be an irritant, dust, mold, bacteria. And this is going to cause bronchoconstriction, increased mucus production, and inflammation of the bronchiolar walls. You're also going to have irreversible changes to the respiratory tract. This is going to occur over time, and it does cause chronic terminal airway obstruction. Also, again, your seasonal changes, as mentioned earlier. These clinical signs from heaves may worsen in spring or summer months just as things get drier and hotter. It is going to cause a flare-up of these type of conditions. And for pathologic changes, this is a little bit of gray area. It's not necessarily defined as early, middle, and late, but there is somewhat of a progression of events. For early stage pathologic changes, you're going to see damage to the surface cilia of the lower airways, as well as necrosis of these epithelial cells. And you're also going to see some Clara cell exfoliation, and Clara cells are just epithelial cells of the bronchioles. Middle stage pathologic changes, you're going to see mucus production increase and an obstruction of peripheral bronchioles. And then finally, late stage pathologic changes, you're going to see an accumulation of mucus in the peribronchiolar alveoli and irreversible changes to the respiratory tract. And this is going to come with an increase in severity of the disease. So for environmental allergens, there are many. There are 3 bacteria listed here first, and as well as mold, hay dust, dust mites and their feces, fungal spores, ammonia fumes, and other nonspecific stimuli. Now, the Aspergillus fumigatus, the first one I have listed here, has been mentioned to exist in normal equine environments. So I think it's at a certain level it becomes an irritant or an allergen, and obviously certain horses are going to have a higher tolerance or lower tolerance than others, and that can be said true for the others as well. For clinical signs, in pretty much every case, you're going to see a cough. Now, this can start off mild and become more labored in time or more recurrent, but pretty much any individual with RAO or heaves is going to at some point develop a persistent dry cough. You're also going to see nostril flaring and nasal discharge, and this is going to be a white milky discharge. Increased respiratory effort, abdominal contractions, this is what's going to cause your heave line, which we'll talk about in a minute. An altered breathing pattern, exercise intolerance, and also weight loss in some cases. So here's your heave line. You can see where the red arrow is pointing here on this horse, the heave line here. And this is caused by hypertrophy of the abdominal oblique muscles of the horse. And basically what's happening, you just got this recurrent constriction, contraction of these abdominal muscles, and that's what's causing that muscle buildup there, and that's what's causing that heave line. So immunologic response in RAO, this is really important to understand because the inflammatory response within the airways is a really important key component of recurrent airway obstruction. So you're going to have activation of pathogen-specific inflammatory cells, transcription factor modulation, as well as release of inflammatory mediators. For your transcription factor modulation, you're going to see an increased expression of neurofactor KB for regulating airway inflammation. And if exposure is prolonged, you are going to see an upregulation of cyclic AMP response element binding protein and a downregulation of AP1. Release of inflammatory mediators, you're going to see increased immunoglobulin E antibodies against specific allergens. And several papers were consistent in stating that these two listed here did show signs of an increase in IgE. For RAO, there are several similarities to human asthma that can be seen. So in people suffering from asthma, you're going to see what's called a T helper 2 cell to be the primary source of your cytokines IL-4, 5, and 13, and that's your interleukins 4, 5, and 13. So in horses, you're going to see something similar. You're going to see a T cell recruitment within the lungs, and then increased levels of IL-4 and 13 mRNA in the airways and peripheral blood. And this is consistent with the similarities of the Th2 response in humans for the development of RAO in horses. So it's just interesting to see that there are definitely similar conditions there. Okay, so this image I took from one of the papers that I used in reference for this presentation, and we're just going to be focusing on the top 2 images here. And they are cytokine mRNA of RAO affected and control horses, and the samples were collected from bronchial alveolar lavage. And that's what BAL stands for there. And you can see the months where they took samples, and then you can read here in the figure note for their method of testing and analysis there. And then each dot in the graphs is going to represent the average plus or minus 1 standard deviation of 6 control and 6 RAO affected horses. And anywhere you see an asterisk, that is going to denote a statistical significant difference within the values. So you can see in June, IL4 and 13 both start out about the same level for RAO affected horses and the control horses. They're both going to increase from here in July and August, a little bit above your control levels. However, the IL13 is going to continue to increase in the month of October, whereas the IL4 is going to dip down below the control horses here in this month. So that's a little interesting difference there. They have opposite effects that are happening there in October as the temp is starting to drop. And it is important to note also that the IL-13 levels are most significantly different throughout the course of the summer going into fall. And IL-4 doesn't make its peak until later in January in the cooler months. And then they're both going to come back down to meet up with the levels, the control levels here in March going into spring. And this is consistent with the papers that I read did show that, IL-4 was increased most of the time in RAO horses, but it was the IL-13 that had the really significant increase and significant peak that was standing out. So for diagnosis, there are going to be several methods. Obviously, you're going to have observation of clinical signs. Again, that's, coughs, heave line, labored breathing, anything like we've mentioned before. You can also use method of endoscopy. It's pretty readily available. Any vet should be able to do this, maybe not on site, but pretty easily. And this is going to show tracheal inflammation, mucus buildup, and you'll be able to see sensitivity to cough here. X-rays, they're okay. They may present normal in some cases, so you're going to get some false negatives there possibly, but they can show increased peribronchial radiodensity. Arterial blood gas analysis can be used. I think it's a little less common, but in your moderate cases of RAO, you're going to have a partial pressure of oxygen less than 80, and in your severe cases, it's going to be about 50 or less. And then finally, for lung biopsy, this is really uncommon. It's an invasive technique, and it's not necessarily recommended, but your histologic changes are going to correlate with your progression and severity of the disease. So for treatment, there are a few methods here. Obviously, you're going to want to eliminate exposure to the environmental allergens that are causing the condition. Making these changes is going to take a little more time, so you're going to need to allow 3 to 4 weeks for improvement here. You're going to want to keep horses on pasture as much as possible, keep them away from being indoors for extended periods of time. You're also going to want to feed a good quality hay and make sure you're always providing fresh, clean water. Now, from a nutritional perspective, this is a lot of the cause of this condition is environmental and a little bit of an immune response, well, a lot of an immune response. But as far as ways you can manage this condition based on nutrition, it's definitely going to be your hay, maybe a little bit in your feed, but you're just going to want to give a good quality hay. You don't want a moldy hay or a dusty hay, a hay with endotoxins. That's all going to just exacerbate the clinical signs of RAO. I know some people, if you can't keep your horse outside all the time, they do keep them indoors. You can even try wetting your hay a little bit. You can try wetting your feed a little bit, although grain does have moisture content as well. And then just, again, always provide fresh, clean water to just keep things fresh. And if they like to dunk their hay, that's good too. So that's ways you can manage that there. Also, you can use bronchodilator therapy. This is going to allow for immediate relief, but it's only going to improve clinical signs. It's not going to improve airway inflammation at all. For this, you're going to need to use your anti-inflammatory drugs, and you'll use corticosteroids for that. So just to emphasize your bronchodilator therapy, it's going to improve your airway constriction and air trapping, resulting from smooth muscle contraction, smooth muscle hypertrophy, and mucus buildup. And you're going to use a rapid-acting aerosol beta-2 adrenergic agonist for this, and it's going to, again, give you that immediate relief of the bronchoconstriction. Some examples of these would be albuterol, probuterol, phenobarbital, and that's similar to human inhalers for asthma. But again, it does not improve the cause of the problem. It's not going to improve your airway inflammation. And this is just a picture of the bronchodilator for horses. I thought that was really interesting. I'd never actually seen one of those. So that was pretty neat to me. Okay, for your anti-inflammatory drugs, it's your corticosteroids. They are going to improve your clinical signs as well as airway restriction and pulmonary function. They're also going to inhibit the inflammatory response initiated by the T lymphocytes. This is the key component of using corticosteroids for treating heaves. They can be used in addition to aerosol bronchodilators to reduce the clinical signs as well as respiratory changes, but you are going to want to proceed with caution here. Corticosteroids can cause some long-term damaging effects, so it's suggested that you would use the lowest effective dose for about 2 weeks and then take a rest period. So you're going to want to rotate off and on from this to avoid causing any harmful effects that can lead to laminitis or loss of immune function. Just a little additional information to wrap up. There is currently no cure for RAO, and horses with severe clinical signs can develop permanent damage affecting the pulmonary function if left untreated. Your best way to prevent this from happening would just be proper prevention management, and that's going to eliminate your incidence of RAO. Use caution, again, when using long-term corticosteroid therapy. This is going to avoid laminitis, loss of immune function, also just there's a series of events that can occur, I think just like a cascade from there. So again, you're just going to want to rotate that off and on for no more than a 2-week period at a time. And of course, always contact your veterinarian for further information and advice if you are in doubt or if you have any further questions. Well, thank you. If you have any questions, feel free to post them on Moodle and I'll get back to you.